Thank you for tuning in to the Ultimate Coach podcast, a companion to the transformative book, The Ultimate Coach, written by Amy Hardison and Alan D. Thompson. Each conversation is designed to be a powerful wake-up call, reminding us of what's possible for you and your life. So if you're on a journey to expand your state of being, this podcast is for you. Welcome to another episode of the Ultimate Coach podcast. I'm Meredith Bell, your host for this episode, and I'm very excited to have as my guest today, Jeff Mars. Jeff, welcome to our show.
Thanks for having me.
Well, I want to give just a little bit of background before we jump into our conversation. Jeff spoke this past May at the Ultimate Experience event in Birmingham on the subject of being in medicine. And he's well qualified to do that because he's been practicing orthopedic surgery in South Dakota for 22 years, specializing in hip and knee replacement. I want to give a special shout out to that event's organizer, Matt Evans, because Matt is the one who put us together, Jeff, and recommended you as a guest. So I'm really looking forward to our conversation today.
Looking forward to it as well. And again, I agree with you. Thanks to Matt Evans for putting us together.
Well, let's start with your whole experience in the world of being, because it actually started quite a while back and well before you met Steve Hardison and got involved in the being movement. So tell us a little bit about that.
Yeah, thank you for asking that. It has been a journey. And I didn't even realize that all roads led to Steve. I met a friend in business world, 2007. And around 5 or so years ago, I don't have the dates exactly right, he had me become interested in a course taught by one of Steve's clients that's centered around the concept of being. It has some different terminology in it. I went to the course. I was resistant at first. Bob was super patient with me. It probably took him about a year to have me see the value in it. Went to the course and saw a lot of value in taking a step back from doing into being. And started coaching with Bob, one-on-one coaching at 2 years of agreements with him. And there was a day back in fall, a couple of years ago, I guess, where Bob was helping me work through a particular issue. And he used the term, commitment is like a black hole. And I said, wow, I haven't heard that phraseology before. Where'd you hear that? And he said, well, I'm watching a video. Actually, I'm rewatching it. I've seen it before. The term is in the video, so let me just send you the video. So, of course, the video was TBOLIT NFL. And it took me a couple of watchings to start to see how much gold is in that video. And then, of course, it just took me down the rabbit trail of internet searching and getting the book and reading the book in a day. And interestingly, my wife and I had been talking about for a couple of years, there's something happening. There's some draw or some pull to Phoenix or Scottsdale or Mesa or something, because it's like every day I would hear something. And I'd say to Marianne, I'm like, I don't know what it is, but something is just drawing us to that area. So after I watched the video and after I read the book, I just came out of my office one day and I said, hey, I know what it is. It's just obvious to me right now. The answer is to go to Mesa and work with Steve. And she was like, oh, well, let's do that. Didn't even have a hesitation in her voice. That's amazing.
It's so interesting. I want to circle back to when you said you first started working with Bob and you had resistance. What was that resistance around?
Yeah, that's really a brilliant question. Thank you for that. I would say it was resistance to change. It was inertia. It was an affront to my ego things of that nature.
I'm curious then, what kinds of things did you hear, or what were some of the key insights you gained that caused you to make that shift and realize this is some valuable information here. I need to pay attention.
Yeah, actually, in Bob's patient working with me to have me see that value, he had sent me a Michael Neal book. And I don't remember which one it was, Inside Out Revolution, perhaps. And in reading that, again, another one of Steve's clients, all roads lead to Steve. In reading that book, I began to understand the concept of we live in a thought-created world. And it shifted in me the possibility of I'm living in an is world, and we all either see it the same way or we're incapable of seeing it the same way, whatever, to maybe we actually live in a world of our own thoughts. And that opened up the possibility for me to see, I guess, if I'm living in a world of my own thoughts, why wouldn't I choose to create it the way I'd want to create it? And I believe that's kind of what led me into that course.
So let's apply this then to medicine. When you have given thought to your thoughts and what you can create, your talk in Birmingham was around being in medicine. So what are some of the things you discovered that you wanted to, how you wanted to be different or how you wanted to do things differently?
Well, I think there's a lot to that. And the talk was a talk with my partner from work, Corey Anderson. He's a physician assistant, a PhD. He and I worked together for many years on the same surgical team, and he's transitioned into leadership roles at a hospital. Really brilliant. But he and I gave that talk together. And for me, there was a time, I could just tell the story. It's maybe a bit repetitive for anyone that was at Birmingham.
Most people that are listening to this were not, so please share it.
All right, I'll retell it then. So there was a day, I'm going to say, again, maybe 5 or so years ago, I don't have the dates exact. I was in my clinic, and I had a patient coming in for post-op follow-up after a hip replacement, and he was about 30 days out from surgery. And I happened to be standing in the corner of the hallway where I could see him walking towards my clinic as he walked. And I was thinking to myself, wow, I couldn't even tell he had had surgery. Even with my orthopedic eye, his gait pattern looked perfectly normal to me. So we go in the exam room and I do the stuff. I look at his incision and it looks great. And his leg lengths are great. And his strength is great. And his x-rays look like they could be on the cover of a technique guide. And I'm like really jazzed over here. And I'm looking over there and he doesn't look so jazzed. And I asked him about it. Hey, what's going on? You don't seem all that excited. And he laid out some really brilliant stuff. One is he didn't feel like that he and I had created the kind of relationship that he'd want to have with somebody who's going to cut his body open. And he had a couple of things that popped up and didn't feel like they were adequately attended to. So we were in conversation, and I think by the end of our conversation, he was overall satisfied. In fact, he even said, leading into it, hey, Dr. Mars, I would have you know that I'm completely satisfied with my hip replacement. But it was the experience that I felt could have used some work. So I was thinking about that. And around that same time, I had seen a TED Talk by a physician, and she had done some research on the placebo effect. The placebo effect is, we all know what that means. You take a sugar pill and you get better. We do a sham treatment, a person gets better. Well, they were looking into what factors play a role in a positive, powerful placebo effect. And what they discerned was that if a patient has the experience that their provider is competent and the provider is compassionate, they're going to have an increased likelihood of a good placebo effect. And I thought, well, I could apply this to hip replacement. knee replacement. I mean, if you can make something out of nothing, maybe you can make something more out of something, right? So around that same time, Corey and I were co-creating our hip and knee center, which is a pretty well-defined way of going about doing hip and knee replacements that we brought to our whole group of about, at that time, about 8 surgeons doing hip and knee replacements, so that we have some standardization, things like that. And I talked to our nurse navigators and I talked to Corey and I said, okay, here's what I propose, is that we show up to the patient looking like we're compassionate and looking like we're competent, and that's going to have an increased likelihood of them having a good experience. I mean, we'd have a desire to be competent, so why not just have the patient experience that? We have a desire to be compassionate, so why not be conscientious about having the patient see that? So it was like we had sunglasses on, and one lens was compassion and one lens was competence. And like anytime a question would come along, well, what should we do in this circumstance? The answer would be, or the process would be, well, let's look at it through the lenses of compassion and competence. And that would oftentimes guide us to an answer that seemed like it made sense to us. So even created a formula around this. So actually, I didn't create the formula. I co-opted the formula. E equals MC squared. You might have heard that one before.
Yes.
So in the hip and knee center, what that means is experience is equal to our mission, our combined group commitment, team commitment to the mission, times compassion, times competence. So we did this for a while, and I was going to give a talk to a PA Association, South Dakota PA Association meeting, and I was sitting in the surgeon lounge talking to one of my partners who's now retired. He's a hand doctor. He came to Rapid City. This was in the time that everybody did everything. So even though he was a hand doctor, he was doing some joint replacements. So I was telling him the story I just told you. And he said, and I have permission to tell the story from him. He said, hey, Marzi, let me tell you about the last knee replacement I ever did. This is my partner talking now. I got in there and the patient had rheumatoid arthritis. The bone was really soft and it kind of crumbled. And I ended up having to do a very complex knee replacement. It was basically like a revision knee replacement. And a revision means like somebody had a knee replacement and it comes loose and we got to put in new, longer, further, deeper, bigger parts, whatever. He ended up using that kind of stuff on her initial knee replacement. And here's him talking now. It came out looking good. Unfortunately, we got an infection in there. And I did all the stuff I was supposed to do. I washed it out. Ultimately could not eradicate the infection. And I ended up having to amputate her leg. And so he says after that, do you know what the last thing she said to me in the hospital was? No, what was it? Thank you. And it occurred to me, she used his name. I just don't want to use his name right now. She said, thank you, doctor. And it occurred to me like it's a flash of inspiration in that moment. Yes. Do you know why that was? Because of who you were being. You were being compassion. You were being competence. And she experienced you that way. So that kind of like shifted or upgraded in my mind. E equals MC squared as a doing to E equals MC squared as a being. So when Corey and I use that term in our bringing being into medicine talk or methodology, that's what we're talking about, being compassion and being competence.
I love that distinction. And I would love for you to talk more about two things. How does that feel from your perspective when you are being compassion instead of doing compassion? And what's the impact on the patient of that in terms of what do they perceive, feel, experience? So I'd love to have you talk about it from both sides.
Well, can I add a little something into this?
Oh, absolutely. I answer that? Sure.
Little context. I was with a person who was on my team who was a person who provided implants. And we were making a shift in the organization to a different company. He was great. I sat down and talked to him and wanted him to hear it directly from me because I wanted to keep him on our team in some other capacity. And he let me know that he wasn't really sure that he wanted that, because he felt like when he showed up in the operating room, his whole mindset was around not making a mistake. And he used to be a professional athlete. And he said, when I show up to the OR and all I'm thinking about is don't be missing an item, don't open the wrong item, don't make a mistake, don't harm the patient, don't make Dr. Morris mad. If I'm showing up like expecting to lose. So when I was a professional athlete, if I showed up to a game playing not to lose, I would not have been the best player on my team. I would show up to a game playing to win. And I realized over the course of time that he was not just talking about himself, he was talking about me, that I have been indoctrinated. I've indoctrinated myself by accepting belief systems that I have been playing not to lose. So go in a patient's room and would we call that lay the crate. Like lay out the worst possible scenario so the patients don't have expectations. So that if something goes wrong, well, I told him, minimize our liability. Or even if we do get a good outcome, it looks like really amazing because something bad could happen. So when I would go through the process before with the patient, it looked like following a script. It looked like it wasn't. This is me talking about how it occurs for me. It's myself. Wouldn't show up like an authentic relating experience. It would show up like, okay, these are all the I's I got to dot. These are all the T's I got to cross. This is the crepe I got to lay. I got to make sure I lay out every possible complication so that they have a truly informed consent. I got to I got to under promise so that I can over deliver. And boom, okay, I've got my package complete. It didn't feel like I was sitting down, looking the patient in the eye and really listening to him with heartfelt listening to the things that weren't being said, to what was really happening behind the scenes, that would have a patient show up in my office thinking about having a big surgery. So by actually having an intention around being compassion, it allows me to experience myself showing up completely different to those conversations. And it upgrades my experience. So it upgrades my experience where I actually feel like I'm playing to win, not playing not to lose. Like when I understand what's really important, like this is a patient talking now, I'm going to my granddaughter's wedding in September and I want to be able to dance the wedding night. Okay. And I can actually feel the emotion in their voice as they're telling me this. Now we actually have an aligned mission. Like that's the mission. The mission isn't to get you through hip replacement. The mission is to get you on the dance floor at your granddaughter's wedding.
That's great. So from your perspective, it really feels different. And what I'm hearing is I was listening to describe how you were in terms of more script-like to really coming from the heart and feeling allowing yourself to feel with that person. The word that keeps coming to my mind is empathy. You're really getting in their shoes and experiencing what they must be thinking, feeling, and experiencing. And so what's the impact on their experience of you when you do that with them?
Well, their experience is their experience. It's my sense that we are forming a deeper connection. It's my sense that they have a higher degree of comfort or confidence going into surgery, because it's normal to be nervous when you're going in for surgery, right? But if we can create it in such a way that there is a certain amount of comfort going into surgery, because, really when you get down to it, what makes the biggest difference in surgical outcome is not the implants I put in. It's not the medicines that we use. It's not my skill set. I mean, this matters. It all matters. But what really matters is what the patient's got going on in their mind, or how they bring themselves to the game. And I tell my patients that. Tell them that every single time I see them in the pre-op holding area, look, we're here committed as a team to do what's necessary to create the best possible outcome with your knee replacement. And I want you to know that I'm good at what I do, really good. And I got a great team, and we're all committed. And what you bring to the game matters more than what we bring to the game. What we do matters, but ultimately, what's really going to make the difference is what you bring to the game, what you do and your commitment, things like that. So I like to get that verbal commitment from the patient that they see themselves as the most important person on the team, or the quarterback of the team, or whatever term they'd like to use, and that they're committed to following through.
It sounds like you're indirectly coaching them on being. And I'd love to know more about how you talk to them. How do you help them see the importance of their role, and how they are being, how their thoughts are going to impact, as you say, their outcome? Are there any specific things that you make sure they understand? Or I'd just love to know more about your conversation with them to help them get to that place of taking responsibility for their part in the recovery process.
That's a big question.
Well, and my guess it's somewhat different with each person based on what you sense their willingness is, because my guess is some of them are like you were years ago, where there's this resistance to turning it back to you and saying, but doc, it's your job to do this. I'm just the patient. Do you have anyone that tends to be resistant to taking that ownership?
Yeah, I think so. I think that's just a natural being of human being, right? Yeah, we have a story in medicine that the patient's just going to show up and expect us to do the work, and they're going to get better and not have to contribute. And that's a story, because I don't believe anybody actually feels that way. I think that's just a story we make up. How I talk to my patients actually is more closely akin to how do I listen to my patients. I have a declaration that I am fierce listening. So when I go into the patient exam room, I really listen. Like, there will be times where for 20 minutes, I don't really say anything other than acknowledge what I've heard. And William Osler, it's a Canadian physician from 100 years ago, has a famous quote: listen to the patient. They're telling you the diagnosis. And, I've heard this in various forms over the course of my training, that 90% of the diagnosis comes from taking the history, listening to the patient. And it's not just the obvious diagnosis. It's as we said earlier, is the what's not said, is the between the lines things that the patients will let you know. So I like to listen to the patient and ask powerful questions and give feedback that I'm hearing them, to the point where they really, I get the sense that they're empty. They've said everything that they want to say. And it allows me to have access to what I really need to ask the patient, have a sense of, do they even really want surgery? I mean, most of my surgery is what we'd consider elective. I mean, it's a good idea. You got a worn out knee and you can't go fishing, and we can fix it. But not everybody actually wants the surgery. What level of commitment they have to doing what's necessary to create the best outcome possible. Just a lot of stuff that I can have access to from really listening fiercely to what they have to say. And there's a lot of factors in that, like the greatest gift we can give another is for them to feel heard. So even having them feel heard is developing our relationship, developing the trust, developing the openness, developing the comfort around undergoing scary surgery. Now, when I do ask for a commitment, I do sometimes get a look of like, I really don't understand what you're asking me, Dr. Mars. And, I just go through it and I'll say, so it's a process. I generally tell people it takes about 100 days to recover from a joint replacement. It's a process, not an event. The surgery itself is an event. It takes about an hour. The rest of that 100 days is entirely up to you. You'll need to manage your discomfort. You'll need to take care of your incision. You'll need to make sure you don't fall down. You need to do your physical therapy, just, all the stuff. And we can do what looks on paper like the best knee replacement in the entire world, but what's really going to make a difference is how you show up to it. And this falls, to me, my mind, into the camp of working through agreement, where I actually want some sense of an understanding and a verbal commitment. Yes, I will do those things and I will do what's necessary. And you know how people are, like Steve Chandler says, really they like to keep their word. If they say they're going to do something, there's a much higher likelihood that they're actually going to do it than if I just tell them what's expected of them and they just sit in the corner and listen to me. If they give me verbal confirmation that they will do those things, I can pretty much count on them doing those things. And then sometimes I get into something really complex, like some patients are really afraid of pain. They've had prior surgery and they've had a lot of trouble managing their pain. We have this Facebook Messenger group that even more people. It was created by Elizabeth Adams. She's a doc in the UK. She's got a few other people on it. Ken Altenbach, pray for him right now and his family. Nargis Kaviani, Elizabeth Forrest, Bina Bindel, Kevin Tipper, Marika Ondakis. Elizabeth had sent me a book called Painless. Painless. And it's written by, and I'm sorry, I'm just drawing a blank on the author's name right now, but she's a pain provider who's trained in 3 principles, and she uses a 3 principles approach to handling pain. So I read the book. It was brilliant. In fact, I personally used the teachings from that book in February of this year, when I had my shoulder replaced, co-created with my surgeon over the course of about a year, it being the best shoulder replacement in the history of the universe. And literally, I had 0 pain. I never took a pain med. So I have a half a dozen or so patients who will take it to a whole different level. We both have an understanding that we would like to fix this. We'd like to create a different future. We can see the default future. If we don't fix your knee where you're headed, we want to change the direction of that future by fixing your knee. And it's a process, and there's a risk that you may have discomfort from what you've told me. And I would like you to read this book and really do your best to incorporate an understanding of principles before we actually do your surgery. We won't be doing your surgery until you've read the book and agree to read the book and tell me what you've learned in the book. And I've had a few of those people who have just had like a remarkable experience after the surgery of like, wow, my last surgery was 10 out of 10 pain and we couldn't even control it. Whereas this surgery is like, yeah, it's a little bit uncomfortable, but it's really not that big a deal. Obviously, I don't think that it's directly reading a book is going to create that for a person because it's happening inside of them, but it's an opening for them to change the way they see the world, I think.
There's so much of what you have been describing to me, Jeff. For our listeners, most of whom are probably not involved in the world of medicine and working with patients as you are, and yet the key ideas that you're sharing apply to all of us, no matter what our focus in life is. This idea of deep listening to people to really help them feel understood. We can do that with everyone. And the trust that gets built, because that's one of the things, you haven't used that word, but that's what, to me is happening in the way you are being with your patients, the trust you're developing with them because of who you're being. You're real, you're authentic. They sense that, they feel it, and they respond in kind by trusting you. And therefore, when you ask them to read something, those that feel they've made that connection with you, they want to agree to that because they sense you have their best interest at heart.
Yeah, I think that's accurate and brilliant. A lot of the stuff is, we're always already being, right? So what we're talking about here is an intention around choosing who we're being. And it lives in every domain of our lives, and it's ultimately transferable to every domain of our life. Interestingly, I actually think that medicine is relevant to everybody because at some point in time, we'll all be in medical care and or have a family member in medical care, part of a team with this working to create a great outcome from the medicine, whether it's with our child or our parent or our sibling. So I think there's a lot of cross relevance here. One of the other things from a team perspective that we do is there's a thing called a timeout. This is a World Health Organization international recommendation or mandate or whatever you would call it, where at the beginning of a surgical procedure, before the surgery even starts, we do a timeout or a surgical pause. There's other terms for it. What that means is everybody stops what they're doing, no music on, no talking, nothing in our hands, all fully attentive. And we do the timeout and we say, who do we have here with the patient's name? We confirm that with the wristband. And what are they here for? And we confirm that with the consent form. We confirm that the surgical site's been marked with my initials as an example, what kind of anesthesia the patient has, what allergies they might have, just everything necessary for us to all be on the same page. This is good doing, right? This is like a checklist. This is like before you take an airplane off, you go through a checklist. Well, in my OR, we do all that, of course, it's necessary, but I believe it's an upgrade where it goes from a doing to a being. So instead of saying, we can say all that, but then in addition, instead of saying, Mrs. Jones is here for a right knee replacement, what we'll say is we're here as a team committed to doing what's necessary to create the most incredible experience possible for Mrs. Jones and her right knee replacement. And in fact, she's planning to go on an Alaska cruise in October. And then sometimes I'll say, does anybody see it differently? Because if you see it differently, we need to talk about it now. And everybody's always like, yeah, see it the same way. And then sometimes I'll say, and how are we going to create that? And then the team will know by being compassion and by being competence. So that sometimes we get into a situation where we see the final outcome and stuff gets complicated sometimes, especially like on a revision case or like the one I told you about my partner with a knee replacement. Sometimes we take detours and back up before we can go forward and it gets super complex. But we see the vision of the outcome and we know we're going to get there. Even when we don't know how we're going to get there, we know we're going to get there. So I think those concepts of the team coming together and agreeing and committing to a common mission and seeing the future even when we don't know how we're going to get there is a very transferable concept.
Absolutely. I got chills listening to you share that because it's so powerful. This idea of time out, where we all take time before we embark on whatever the action is to prepare ourselves mentally and to really think proactively of who am I going to be in this situation? How will I be? Not just the checklist. I love that contrast between those very important things, but then framing them in the context of the outcome, the vision you want. And of course, the emphasis on not being concerned about the how-tos. Obviously, in surgery, you have to know the how-tos. But as you say, just like in life, we're going to encounter unexpected twists, turns, complications that we didn't necessarily expect or don't want to welcome. And yet, how we are being in that moment is going to determine how we respond to them and ultimately the outcomes we get.
Brilliant. You said a couple of things on that really resonated with me. And one is, again, there's two sides to this. Compassion is only half of it. Competence is the other half. The best way to occur to the patient as being competent is to actually be competent. That's unnecessary. And the other is, that taking the time to prepare ourselves. You may not get this quote exactly right, but the Abraham Lincoln quote, that's something on the order of, give me 8 hours to chop a tree down and I'll spend 7 hours sharpening the axe.
Mm-hmm. Mm-hmm. Yeah, that is powerful. And I think one of the big takeaways for me in our conversation today is the reminder of slowing down, taking that time to invest in in thinking about and preparing for who am I being in this moment, rather than jumping into doing, because the doing is so prevalent in our world, in our society, and how we get judged by others. And yet what we do, as you were saying, we are always already being. It's what are we doing to be intentional about it?
Brilliant. We focus on the being, the doings will just happen.
I would love for you to share in the final few minutes we have together, Jeff. I know you've been working with Steve Hardison. Are there certain takeaways? I know there are lots, but are there certain ones that you would like to share with our listeners today that may be useful for them in their own lives?
Yeah, Steve, boy, I think I'm only one guy in his office, so I can only infer from the things I've heard others say about their personal experiences. But it seems to me that there is no canned approach. Everybody's going to get a different, I don't know, experience, I guess. So, yeah, I don't know that there's a way of going about approaching this where this would make sense for everybody, but I can tell you a few things that have made perfect sense for me, and they might be transferable.
That's great.
One is we human beings, at least as far as I understand it, have non-powerful thoughts. Thoughts are things. Thoughts create being. Being is everything. Being creates doing. Doing creates outcomes, right? So if we go back to our non-powerful thoughts, ultimately they're going to create non-powerful outcomes. So we'd want to change those thoughts. We want to get intentional around changing our thoughts. So the term that I use with Steve is surgical thought replacement, like very specific non-powerful thought. Replace it with a very specific thought that is powerful and not just affirmational, like true, like getting deep down in your core, what is actually more true about this new thought, so that it doesn't just like stamp it on top of the old thought. It actually replaces the old thought. So I like to think that I'm a powerful thought replacement surgeon. Another is along those lines, this has to happen in order for it to function. This is flowing in our bloodstream, so it just happens. But it's like an event happens, and it's like there's an event handler happening inside of us. But when something comes along, there's like an interrupt, and the interrupt will produce an outcome. So things like, it's in the gentle art of blessing. Interrupt. I feel like judging someone. Boom. Instead, I'm going to bless them. And I'm going to bless them in the context of the way in which I had initially felt like I would judge them. Another, and this is the one I'm most excited about, Steve has allowed me to completely change my life. Well, this is a little bit of lead into this one. Super, super powerful for me. I used to see myself as a procrastinator. I would have a phrase in my mind that, why do today what I could put off till tomorrow? Completely twisted on the real meaning behind that phrase, right? And everybody knew Jeff's a procrastinator. At least my story was, I believed everybody knew that Jeff was a procrastinator. You couldn't count on Jeff getting stuff done. And this was a very non-powerful thought that I had about myself, a judgment of myself, a listening of myself that did produce a way of being, that did produce an action, that did produce a non-powerful outcome. And when I brought this to Steve, we went through the process of out creating that with something that's actually more true. And what's now more true for me is I am the ultimate pro-actionator. And the interrupt happens that whenever I get the feeling like, oh, I'm just going to put that off, the moment that happens, there's an interrupt request that says, get an action around that. It doesn't mean I have to go clean the whole house, but I do something that that aligns with actually getting that something done. Even if it's just one tiny step in the right direction. Every single time I have the desire to procrastinate, instead, I am the ultimate pro-actionator, and I take at least one tiny step towards creating that desired outcome. And I'm telling you, like, I don't procrastinate anymore. It was like he just wiped that out of my life. It's amazing for me.
Just absolutely love that. I love everything you shared about your experiences, talking about the non-powerful thinking leading to non-powerful outcomes. And I love that example you gave of yourself and that transition you made. I bet you every one of our listeners can think of one thing they've said about themselves. You know, Steve Chandler calls it labeling ourselves. I am this, I am that. And going through that process of digging into it and looking at what is more true for you. And I would encourage each listener to do that. And the idea of not covering it up, but actually replacing it so that you immediately notice when you are labeling or calling yourself anything related to procrastinator, and then transforming that into who you are now and reminding yourself of the real you. That's a beautiful place, Jeff, for us to wrap this up. Thank you for the gift of you and all of what you've shared with me today and with our audience. I know there's so many nuggets in here. I would encourage people to go back and listen more than once, because sometimes we listen the first time just to get the information, but the second time we can go deeper and really absorb how this applies to me. And there's so many things you've shared today that give us that opportunity. So I want to acknowledge you and the wonderful work you're doing with your patients, the way you're being in medicine, so that you're impacting lives, not just on the physical level, but emotionally, mentally, spiritually, the impact you're having on each person who has the opportunity to work with you. So tell us how people can connect with you, Jeff, and learn more about what you're doing and being.
Well, first of all, thank you for this brilliant conversation. I acknowledge you for who you're being and leading these conversations. It's really amazing. If one were to have a desire to find me in the domain of orthopedic practice, go to www.jeffmars.com, and that will lead you to my practice website. Within the domain of being, most of my activity is on the Ultimate Coach Facebook group. Easy to find me there. Those would be the two places I would recommend.
That's great. Jeff, thank you again for being with us and for the wisdom and insights you've shared with us today.
Thank you. Have a great day.
Thank you for joining us today. If there's someone you know who could benefit from this conversation, please share this episode with them. Also, check out our website, beingmovement.com. You'll find valuable resources and links to connect to an engaging and wonderfully supportive community. Together, we can inspire and support each other on the path to a greater understanding of being. Until next time, take care and be kind to yourself.